Personal protective equipment, or PPE, is a vital component of infection prevention and control. PPE will help to keep you, patients, coworkers, and visitors safe from disease. Donning. Perform hand hygiene with alcohol-based hand rub. Rub hands together, rubbing palm to palm, in between and around the fingers, on the back of the hands, as well as the fingertips and nail beds. Continue rubbing until hands are completely dry. Visually inspect the PPE ensemble for rips, tears, or other damage. Don gown. Fully cover torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten at the waist and in back of neck if applicable. Ensure all clothing is covered by the gown. For donning a new N95 mask, hold N95 respirator in the palm of your hand with the straps facing the floor. Place the N95 on your face, covering your nose and mouth. Pull the bottom strap up and over your head, putting it behind your head below your ears. Pull the upper strap over your head towards the crown. Mold the nose piece over the bridge of your nose to form a tight seal. Perform a seal check by quickly breathing in and out to check for air leaks. If there is an air leak, readjust and perform another seal check. Continue until there are no air leaks detected. To safely don any reused mask, perform hand hygiene, don new gloves, reach into paper bag trying not to touch the inside of the mask, don mask and ensure proper fit, adjust as necessary. Discard gloves, perform hand hygiene. Don goggles by handling straps and adjust to fit. If donning a face shield, pull strap over crown of head and adjust to fit. Don gloves. Ensure the bottom of the gloves cover the wrist area of the isolation gown. Skin should not be showing. Change gloves when torn or contaminated. Perform hand hygiene between glove changes. Prior to entering the patient room, the healthcare worker should verify the integrity of their PPE. This is to assist the healthcare worker to remove PPE without contaminating clothing, skin, or mucous membranes with potentially infectious materials. For patient rooms with anterooms, remove all PPE. For patient rooms without anterooms, remove all PPE except eye protection and mask or respirator. Healthcare workers need to avoid reflexive actions such as touching their face until the doffing process is completed and hand hygiene is done. Inspect PPE to assess for visible contamination, cuts, or tears before starting to remove. As the healthcare worker removes each item, place the contaminated PPE immediately in the designated waste receptacle. The front surfaces of all PPE is contaminated. If your hands become contaminated at any time during the doffing process, immediately complete hand hygiene. To begin the doffing process, grasp the gown on the front and pull away from your body so that the ties break, touching the outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out and bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Dispose and complete hand hygiene. Remove goggles by tilting head forward slightly, then grab the frames at the ears and pull off in a forward motion. If wearing a face shield, remove from the back by lifting the headband. Avoid touching the front of the goggles or face shield at all times. If hands get contaminated during removal, perform hand hygiene. If the item is to be reused, don gloves and wipe with a hospital-approved disinfectant. Discard gloves and perform hand hygiene. Allow the goggles or face shield to air dry before reuse. Remove mask. Ensure hand hygiene was completed prior to the removal of the mask. When removing an N95, pull bottom strap up and over your head, being careful not to touch the front of the mask. Use both hands to grab the upper strap and pull up and over your head. Keep tension on the upper strap as you remove it. If the N95 mask is to be reused, use a paper bag to store the mask and label the paper bag with your name. Place the N95 in the paper bag. Perform hand hygiene.